Good afternoon. We're here today with Doreen, and she is a Pink Power mom. Doreen, we've had the privilege of working with you today, and you're being acknowledged for your amazing work as a Pink Power mom. Can you tell us a little bit about that?
It was an amazing surprise. I'm self-nominated. I nominated myself, and I was just really surprised to get the call that I was one of the winners.
Wow.
Yeah.
I love the fact that you nominated yourself, so you obviously had a lot of confidence in the work that you're doing.
Yes.
And you are a breast cancer survivor.
Mm-hmm.
And can you tell us about the work that you're doing in your community and in your country?
Here in the U.S., I work with NBCC. I'm one of the NBCC trained advocates.
Mm-hmm.
I lobby on Capitol Hill once a year.
Wow.
For breast cancer funding, of course. And most of the work that I do is in Zambia. I founded Cancer Support Network of Zambia with a group of other survivors. And we have just taken awareness to another level. We do advocacy, we do support services, and literally just raising awareness, because it was awareness was very low in Zambia when we started. There were a few organizations that were working, but there were parts of the country that they had never been to, and lots and lots of women had no access to information. So we are slowly getting into the rural areas, into the villages where people have no access to information, no access to screening, and we are slowly bringing in these services to them.
That's beautiful. Have you found that with the work that you're doing and bringing awareness, are there a lot of undiagnosed women in Gambia that have breast cancer?
Absolutely.
Really?
Absolutely. We find a lot of women that are stage 4, stage 3 breast cancer, never been to the hospital because they don't know what breast cancer is. They've never heard of breast cancer. But cancer does not have a disease in our vernacular language in Zambia.
Wow.
So most of the time women get breast cancer or any other type of cancer, it's assumed they've been, it's opiate or what you call witchcraft.
Oh, okay.
And they don't really go to the hospital. They would rather go to a traditional healer for help. And by the time they realize that the traditional healer can help them, and the time they get to the hospital, it's really too late.
Wow. I believe a lot in self-care and just trying to do all that we can do to try to maintain our health and be healthy. Do you have any health tips or health and wellness tips that you would advise for women?
Sure. I tell women to be self-aware, to be self-breast aware. Know yourself. Know how your breasts feel like. If you see anything that doesn't feel normal, that doesn't feel like you, because you know your breast, you know yourself. Anything that doesn't look like, doesn't feel like it's you, go for help.
Okay. And what about women that are afraid to go to the doctor because they feel that they don't have insurance? What would you recommend, or what would you suggest to them?
I would suggest they look in the community. There are organizations now, especially here in America, that offer services to people that don't have insurance. I would suggest they go out and look for information and look for these organizations, look out for them, and find out who can help them. Go to the hospital. The hospitals have big organizations giving them funding, giving them grants to help women that don't have insurance.
Wonderful.
So staying home is a no-no.
Yes.
Go get help.
Yes. Well, I love the fact that you've taken ownership over your life and your future, and you've made this a positive way for you to really reach back and uplift others and pay it forward and try to save lives.
Absolutely.
Thank you so much, Doreen. It's been a blessing
My
to
pleasure.
connect with you.